The UCLA Institute of Transportation Studies acknowledges the Gabrielino Tongva peoples as the traditional land caretakers of Tovangar, where the UCLA campus lies today. We also recognize that the UCLA Lake Arrowhead Conference Center sits on the territory and ancestral land of the San Manuel Band of Mission Indians, the Uhaviatam people. We would like to thank the sponsors of the 2020 UCLA Arrowhead Symposium online series. Their support enables us to bring you today's program. In particular, the support of Transit Center has made this session possible. This is an interactive session. To participate in this session, use Zoom's built-in chat, Q&A, and raise hand features.
Good afternoon. My name is Brian Taylor. I'm the director of the UCLA Institute of Transportation Studies, and I'm pleased to welcome you to the next in our Arrowhead series. This afternoon's session is Informing Transit's Recovery, and we're lucky today to have two distinguished panelists to speak on this topic. Phil Washington, the CEO of LA Metro, and Darnell Grisby of the American Public Transportation Association. This session looks at the issue of transit in the pandemic and afterward. Transit thrives on density. It's most effective in serving mobility needs in corridors where concentration of people and places live, work, play means higher trip demand and densely packed vehicles. This density is antithetical to public health measures to control the spread of COVID-19. The pandemic has affected transit demand, supply, funding, management, and politics. Things are in a high state of flux, and we're going to reflect on that this afternoon. The session's organized with a research presentation by me to begin, and I'll talk a little bit about that in a moment. Then we'll have a discussion with Mr. Washington and Grisby, where I'll offer a few questions and we'll welcome questions from the audience as well. So pay attention to the submission of Q&A, and we'll manage and try and get as many of you in as possible. So I'll begin with that, and as soon as I'm done, we'll turn it over to Phil and Darnell. So let me begin. Okay, the title of the talk is Monitoring Adjustments to Transit Service During a Pandemic. And what I'm going to talk about first is the motivation for this research, a little bit about what we did. I'm going to talk a bit about how transit use is changing, how transit service is changing, what's motivating those service changes, how crowding and social distancing are managed on transit, and then what the equity effects are of these changes. That work is ongoing, so I'll give you just a preview of some of that. Then I'll close with some takeaways. So first, the research motivation was really came from the spring of 2020. And at that time, ridership was in a free fall. Transit operators around California and around the country were scrambling to adjust to public health orders and plummeting demand. Traditional methods of service planning and performance evaluation were of little use. Suddenly, the tools that we had on hand were no longer applicable. So the questions that we're facing agency, and we began this by conducting some interviews with transit managers around California. We were told a variety of questions, and it actually varied from agency to agency, depending on larger or smaller. Some of the questions were, what can we learn from previous pandemics? What can we learn from other transit operators? How are riders and ridership patterns changing? How best can we serve the needs of those most dependent on transit for mobility? What are the new pandemic states of practice with respect to forecasting service needs, crowding standards, measurement of performance, and so on? So what we did with that sort of laundry list of topics is we had a multi-pronged research approach. First, we ended up doing 13 in-depth interviews with senior trans-agency staff from around the country, some at the beginning of the project and some further along. We did a careful review of public health research on transit and epidemics. Some of that was fresh research that had just come out, some of it from earlier epidemics in other parts of the world. We surveyed a random sample of transit operators around the country, and we also concentrated on that sample in California. And we got responses from 71 transit agency staff across the US on various aspects about the pandemic and its response. We also gathered data and analyzed service supply changes for 35 US transit operators. We looked at real-time transit ridership analyses for 7 operators. We looked at the crowding policy of 200 transit operators, again, a sample around the country. And ongoing is this analysis of the equity implications of the service changes. So it was a wide array of sources of information we went to, but focused mostly on gathering information from the transit operators themselves. Now, this is a rapid response project. We were trying to do this with support of funding from the state to turn our results around as quickly as possible to make them as useful as possible for transit operators. So most of the work that I'm going to talk about today was completed between late June and just now in late October. And as I mentioned, a bit of it is ongoing, but most of it is complete. That was a big topic, and we had a big research team. They're listed here. So they were undergraduates, master's students, doctoral students, and staff, research staff working on various aspects of this project. And many of them are on the line right now. So first, I want to go to this question of how transit use is changing. And this might look a little more optimistic than graphs you might have seen, but this is actually global ridership trends from January through September. And this is from Apple Maps routing requests. And what you can see is on the y-axis there, that's 100% of demand of January 13th. You can see that the ridership was trending up slightly going into February, and then that free fall from the lockdown that came during March and into April. And then that sort of a Nike swish recovery that seems to be flattening out as we're getting into September. That's globally. Here in the US, we see a different pattern. The recovery has been much flatter. And we think the reason is that transit plays a different role in cities around the world, and a more central role to mobility. There's fewer options to travel for car, by example, in many other countries. And so there we see that the response within the US has been somewhat flatter. Here in California, things have been flatter still. So ridership in California is just a bit below 50% of where it was in January and February. It's a little over 50% for the US, where it's between 80 and 100% globally. So to understand that pattern with the US, I think it's really important to understand sort of the 2 principal US transit rider markets. First is people with little or no access to private vehicles. This is often due to limited income, disability, or age, although it can be by choice, and that is a small but growing share of those who have little or no access to vehicles. The population of riders is disproportionately Black, Indigenous, and people of color and/or immigrants. And so what we see is it's a strong social service basic mobility function for people who don't have the ability to get around in cars. And the second is for people traveling to places where parking is difficult or expensive. These are downtowns, airports and train stations, universities, places where it's actually difficult to drive in and out of. Congestion is often endemic. You tend to have more higher income and white riders into these areas, but overall the mix of riders is still quite diverse. And by no means is it majority white or majority high income. This is nationally. Now, evidence from multiple sources suggests that ridership by those in this first group is down moderately and has been growing in recent months. So that's part of the recovery we've seen. By contrast, ridership by those in this second group is down dramatically and is recovering much more slowly. This is in part because there are higher opportunities to work from home. These riders are more likely to have an automobile available to them. So there we see the recovery has been very slow. And so it's really important to understand this shift really in transit ridership toward that first group of riders. Now, when we look at California, and this is the urbanized areas in California, you see something kind of interesting. You can see that drop. We go back into 2018, 19, and into 20. This is per capita ridership, so trips per person. You can see that we had that big drop in March of 2020 into April, but the Bay Area, where transit ridership per capita is much higher, had a much bigger plunge. Now, we happen to have finished research for the Metropolitan Transportation Commission that looked at ridership in the Bay Area. And one of the things we found is that riders in the Bay Area tend to be more affluent. There were more people who travel on transit that going in and out of particularly downtown San Francisco who have autos available to them. So a larger share of that second group of riders, and that's where we saw the plummet. So that now the Bay Area doesn't look so different from the rest of the state in terms of its transit ridership profile. Now, one thing about this is that some of the systems around the country started making real-time data available to their riders during the pandemic, some before and some picked this up during the pandemic. We collected these data for a variety of systems and used them to visualize recent ridership levels on places as diverse as Boston, Little Rock, Ventura County, Pullman, Washington. And here you can see just an example of where people could see the level of crowding on a system, and I'll talk more about that in a minute. We have that interactive tool at this website. I'll show this to you several times where you can go there and you can actually do the queries yourself and look at some of the ridership patterns from the real-time data. So that was a look at ridership. So how is transit service changing? So in our survey of 71 transit professionals, 19 out of 20 of them roughly, or 95%, reported that they've modified service during the pandemic. This is sometime between March through August, actually in some into September. 85% of those have adjusted service, bus service more than once, and about a quarter have adjusted it 4 or more times, meaning these are not just minor adjustments, but they've made service adjustments in response to changes during the pandemic. One of the things that we've done as well with this interactive tool that people can go and look at, again, located at that web address, it combines GTFS data for multiple operators in LA and San Francisco before and after the start of the pandemic, and you can see where service is changing. So in this map, lighter shading indicates larger PM service cuts across all operators serving a given census tract. So you can see the city and county of San Francisco, which would be mostly San Francisco Muni, but includes other operators, including BART, Samtrans, and Golden Gate. And you can see that lighter areas is where ridership is, service is down more. Darker areas is where it's closer to what it was pre-pandemic. You see similar patterns over in the East Bay, where BART and AC Transit are the service operators. In the more affluent hills areas, you have a bigger drop in ridership. Marin County in the top left, you see something quite different. This is a higher income area, and you don't see as much service drop. So you see quite a bit of difference from operator to operator and how service has changed across the tracks. So with respect to the type of service changes that have occurred, we surveyed a variety of operators, and for small and medium-sized bus operations, this gives you an idea of the shift in service. The modal change was between 50 and 75% of pre-pandemic service as of September 2020. For the larger bus operators, you can see that service tends to be somewhat higher. This is in terms of the number of agencies responding, but it's closer to 75 to 90 or even 90 to 100% of pre-service. And rail, you see something flatter, again, from the responses, the reports of adjustments of service. And that's percent of pre-pandemic levels. So on average, the smaller operators tend to have service today about 70% of what pre-pandemic levels were. Large bus operators about 85%, and rail operators also around 70% of pre-pandemic levels. We asked as well about the things that were affecting service change, and one was what we described as labor events. These were, in the light bar is operators. These are people who drive the buses and the trains. On the right are agency staff. And as you can see, if we look at the operators, about 2/3, the number of taking voluntary leaves was an issue. Furloughs is a significant issue for operators as the service was cut. Medical leaves, about half the operators reported this was an issue that's affected service. and reductions in overtime as well. So there's been significant changes on the labor side in terms of responding to the pandemic, which of course ripples through and affects people's incomes as well as their ability to cope with these changes. We also asked about fares, and interestingly, about 40% of those operators surveyed have not changed their fare policies at all. In California, it was about a third. At the other dramatic end, you have fares are no longer collected at all. So about a third of operators nationally reported that, and about 40% of operators in California reported that they no longer collecting fares, and this is of September. In the other category, most of the others were agencies that had discontinued fare collection for a time, but have since restored fare collection. So they really went from the second group back to the first. And that was about a quarter of all operators nationally, and about 20% in California. And then finally, fares are not expected, but not expressly discounted or discontinued either. So people can pay, but it's not required. And about 5% of operators nationwide were doing that. So we also asked some questions about what was motivating the service changes, what information, what guidance are they using? And what you can see is it was changes in ridership data that was the main thing. 85% roughly of operators reported that changes in ridership data where they were using to make service planning decisions. Over half reported the directions of public health officials as well, particularly related to efforts to try and keep crowding to a minimum. Crowding data, budget limitations, and Title VI considerations were also mentioned by at least a quarter of the agencies in terms of what was guiding ridership changes, or excuse me, service changes. But again, changes in ridership were the number one. We had this research didn't focus on finance, but we did, out of the interviews, hear from folks about financial shortfalls affecting service. And we see some distinctive patterns here. Everything that's in blue is that financial shortfalls were affecting service provision anywhere from a little to a great deal. And yellow or gold was not affecting things. You can see that nationwide, a little over half of the operators reported that financial shortfalls were affecting their service provision. But if we go to the bottom bar, that's agencies in California, and there we see a different picture, where 1 in 5 operators nationwide said financial shortfalls were affecting service a great deal. Nearly 3 in 10 were saying that in California, and about 70% were saying that finances were affecting change. Also, if we look at larger agencies, that's the second horizontal bar, and larger agencies, it's the larger agencies that are reporting the more severe financial problems. Now, it obviously varies a great deal from operator to operator, but we do see that pattern where the larger agencies, and if you recall, they had restored more service on average, were reporting larger shortfalls. So we also asked about the agencies where they were relying on their public health guidance. There's been, we have a decentralized system of public health in the United States, and that's reflected in this response. So the light blue bar is all US respondents, and dark is California. The largest single source was the county public health offices where people were getting their information. You can see that there are also significant amounts, the federal CDC, states, and municipal government, so a wide array of sources. And that may be reflecting the wide array of public health guidance that agencies have been getting. We looked at research, previous research and ongoing research out of this pandemic on what we know about the relationship with public transit and public health. This has gotten a lot of play in the media, and there are different elements. One is, does moving people around change the vectors of the diseases? I'm not going to talk about that. I'm going to talk about risk of infection on public transit. What we can see from the literature is that transit can be a relatively safe environment with respect to the transmission of disease, but this really depends on a wide array of factors. It's not necessarily dangerous or necessarily safe. It depends a lot on actions, many of them outside of the control of transit operators. There is a positive association from a variety of studies, many of them looking at flu epidemics, but other transmission of tuberculosis and other diseases, between infection and transit use. But such associations occur in any venue of human-human contact. And the infection risks are comparable to other public settings where many surveys show that a heightened fear on public transit that probably isn't warranted. there tends to be less risk on public transit than sustained contact settings like home and work environments. And infection risk can be reduced by agency actions, especially when they're in concert with coordinated, comprehensive public health response. So we've developed a way of kind of thinking about this. This is a conceptual model of how we can think of this. If we look at the top, we can think about the characteristics of the infectious disease. So there's the means of transmission. So with flu, touching surfaces tends to be a more important thing. And early on, there was a lot of attention paid to sanitize and cleaning. That's not unimportant, but the CDC says that the airborne transmission is the primary way with COVID. And we can also look at ease of transmission. So COVID tends to be more easily transmitted than flu, but less than the measles, for example. And so that plays a factor into it. So over time, we're doing more and more to think about airborne transmission in the way that we try to make transit vehicles safe. We think about travel behavior characteristics. One issue is the duration of exposure. Many people get on transit, they ride for a few minutes and they get off. That's very different than being in a enclosed environment for many hours, and that has a lot to do with the risk of infection. And then the level of proximate contact. So in a transit vehicle where things are relatively spaced out, the level of proximate contact is quite low. If there's a high degree of crowding where people are pressed up against one another, that is relatively high. With the characteristics of public health inventions, we can think about transit-specific responses. And over time, again, it's cleaning and sanitizing vehicles and increasingly focusing on ventilation, filtration, opening windows, trying to move air as much as possible. And we know that has a huge effect with respect to COVID. And the community response is absolutely critical, but largely beyond the control of transit operators. High degrees of mask compliance, making an effort to engage in social distancing, have a huge effect on that. And that's something that really is not specific to transit, but community-wide in general. And then finally, the characteristics of the epidemic is that the likelihood of exposure is the likelihood of positive infection rates. And that varies a lot over the course of this pandemic. In places where infection rates are very low and there's contact tracing and quarantine, the risks of infection are exceedingly low because essentially the chances of someone getting on who's asymptomatic and infectious is low. Where you're having spikes, it can be higher. So these factors work together, a constellation, to create the relative risk profile. As we mentioned, overall, it tends to be less than other sort of high contact settings like home and work. So finally, the last completed part is how is crowding and social distancing managed? We surveyed a variety of transit operators. There's clearly no industry standard. So some published pre-pandemic and COVID crowding standards. Some have not amended their pre-pandemic standards. Some agencies didn't have published crowding standards. They might have had them for internal uses, but they published them for the first time during COVID. And some published no standards and continue to have no standards. At least they don't make them public. This gives you an example of how those standards have changed. In a sense, they're down 70 to 80% in terms of the acceptable levels or the desired levels of people on a vehicle. And this gives you an array of what we got from those. So this is about how they've lowered in terms of what they're shooting for. And obviously, as demand goes up to maintain that level of crowding, it requires a big increase in service, which is an enormous challenge. We've also done some work pulling together what people have done to publicize and visualize crowding. So some agencies have allowed people to have apps and they can get an idea of what might be expected in terms of the number of people on a vehicle. In this map, red dots indicate a higher probability that there are multiple passengers and there may be crowding on a vehicle. Red would be high degrees of crowding, yellow relatively low. Again, you can explore this at our interactive tool on that web address. And finally, the ongoing work relates to sort of the equity effects of all of these changes. And again, this is still in process. We're looking at how transit ridership has changed across neighborhoods by race and ethnicity and income. We're looking at whether shifts in transit service provision reflect these changes. Preliminarily, they appear to be, but we're still looking into that. And does crowding on vehicles vary across neighborhoods? And we're just beginning that work as well. These are some data from Transit App early in the pandemic. And again, it goes to the things I raised at the outset. that quickly we saw that transit riders during the pandemic are poorer than they were before. A big drop in higher income riders, a big increase in low income riders. They're more likely people of color, African American, Latino, Pacific Islander, and less likely white or Asian. We see that the highest degree of ridership is among people in service industries and in healthcare, and low in professional industries. It should come as a surprise to a few of you. And then whether someone has their transit app set to English or Spanish, we see English is the darker line, and the drop in riders early on in the pandemic was greater than those who had their app set to Spanish. This is just a peek at some of the things we're doing. One thing I can identify as a correlation between the percent BIPOC in a track and changes in ridership. After you can statistically control for that, this shows where transit ridership is higher or lower after controlling for race, ethnicity, or track. And it indicates that we see distinctive patterns there as well. That's just a taste for some of the things we're starting to look at. So to wrap up, there are several takeaways I want to leave you with. We saw that spring ridership declines were sudden and dramatic. Riders are returning, albeit slowly, and a little bit more slowly in California than the rest of the country. Returning riders are more likely low income and BIPOC. System adjustments are often substantial and frequent. We have evolving public health guidance, which has come from a variety of sources. Service changes have been uneven. We have divergent fare policies and changes are ongoing. The research on public health says that transit can be safe to ride. Agency and rider actions matter a lot, but community-wide public health response is critical as well. Socially distanced travel is an increasing challenge as more riders return for many transit systems. Some agencies have crowding standards and communicate vehicle crowding in real time. Most do not. Funding challenges appear to be looming ever larger. It's affecting service at some agencies, especially larger systems and those in California. This is all highly contingent on federal action, which is in flux right now. Pandemic users are more likely low income and people of color. Many systems appear to be shifting their service to meet this shifting demand, although we don't have conclusive findings on that yet. So with that, that's an overview of what we've done. Again, you can go and find out our visualization tools, background data, working papers, our policy briefs, and our publications as they appear will be on this website, monitoring and adjusting transit service during a pandemic. So with that, I will close. And again, thanks to the many students and research staff who supported on this effort. Now, what I'm going to do is stop sharing this. And I'm going to open things up. If we can bring our two panelists on, I'm going to, all right, so I'm going to come in here now. We're going to be taking questions from the group. But in the meantime, I have a few questions for folks. I'm going to start. I'm going to get there we go. The first one I want to ask Phil and Darnell some questions. The first one I'm going to ask for Darnell, just a little bit about, can you tell us what we've learned over the past 7 months? And how can transit operators do a better job of serving the needs of disadvantaged travelers in the months ahead, given the patterns that we're seeing with respect to the shifts in demand?
I would go a little broader and just say we've learned that the political environment is difficult but has upside, meaning that Americans are confronting institutions like never before, which allows us to actually make different asks. So now's the time to ask the question, how do we fight for the curb to ensure that buses can flow more quickly through traffic? Do we do pilot projects more often? These sort of questions are critical to position ourselves better for after the pandemic. So I think it's a combination of the pandemic itself, plus the movement for Black Lives Matter, means that Americans are questioning our institutions, how we fund things. our processes. So it's actually a great time for transit to realign those political forces, to make a different set of demands, to make sure that we can protect the most vulnerable amongst us. And I think the American people are ready for that because they're asking those questions everywhere. How can we reform these institutions?
So Phil, similar, I know that you're, I didn't mention this, that Phil's also on the national, I think you're co-chair of the APTA COVID Response Task Force, but of course dealing with things in LA. Are you finding it easier to make these kinds of adjustments, the kind of pilots that Darnell is talking about, testing out ways of making changes to deliver service more effectively? Is that easier to do during this uncertain time? Is it a bigger challenge? Can you talk a little bit about some things you're doing in LA on that front?
Yeah, and first of all, thank you so much, Brian, for your research and that of your team. I think listening to your presentation is very, very interesting, and I want to make sure I get a copy of those slides. And of course, it's great to be on with Darnell as well. I think that the changes that Metro has made since March or so have been incredible. And your question of whether we can start these what I'll say like micro mobility initiatives and innovative things in this current normal is something that we have been trying to do during this pandemic. Darnell mentioned also the civil unrest that was happening at the same time, which, we definitely cannot forget. Our focus has been, our being Metro, we have concentrated on maintaining service so essential workers can report to their jobs. I mean, the idea that we are dealing with so many essential workers, and they are the foundation of our economy, and providing the cleanliness and the safest transit system possible, especially for those essential workers, is very, very important to us because we know that they have relied on our service up to now. And these are police, firefighters, and medical workers and people that work in retail and supermarkets and all of that. So I'm proud to say that we have been serving them throughout this pandemic. We reduced our service by about 30%, between 30 and 40%, I'll say. And then we added back about 10% since the economy has begun to reopen. We are relying on the data from the system and on the ground realities to adjust service levels. And I think that is a very key point. You touched on that during your presentation as well. How transit agencies are what I call reacting to on-street realities. And that becomes very, very important. Our ability to react to on-street realities throughout this period and really adjust service as we see it and add new resources and add assets on various lines as we see the need. Now, all of that was coupled with, and you mentioned in your presentation, Brian, leaves, availability of manpower, availability of bus operators during the pandemic is another challenge, right? People said to me, hey, Phil, just put out 100% of your service and they will come. But guess what? They were in a stay-at-home order. So people could not come. And so it made sense to reduce our service. And the same thing applied to our workforces. A lot of them were out too, COVID related or childcare, which is a huge piece. And so we implemented many, many health and safety measures, which we might be able to talk about. Many of those will become permanent in the future. I think not just for Metro, but for transit agencies all over this country. And so our cleaning regiments, we're relying on really cleaning regiments, good air circulation, and face coverings. Hopefully we can talk about social distancing because I have some strong opinions on that as it relates to financial sustainability. And you mentioned that in your presentation too. So I think these new normals, micro transit for us, mobility on demand, things like that we're doing. We were doing these things pre-COVID as well. And we have upped the ante on many of those things, including helping to deliver food in our mobility on demand initiative as well. So yeah, I think this is very, very relevant. We did not lay off any personnel at Metro. And there's a discussion behind that too, that we may or may not have time to do. But I think, as ridership comes back, and I love that graph that you showed, I mean, it's coming back, but slowly. We normally carry about 1.2 million people a day on Metro. We got down to about 300,000 a day. That's a huge drop. But now we're back up to almost 650,000 a day. And so, I see a lot of people, laying bus operators off. I think, one, we don't want to contribute to the region-wide economic fallout here by putting more people out. And at the same time, as ridership increases, you would, by laying folks off in great numbers, you would be hit with retraining costs and all of that to bring new people in. And so we really gauged all of that. So long answer, but I got a lot, I could talk about in this area.
So Darnell, can I ask you, to pick up on what Phil had just been talking about is, you've got kind of the whole nation sort of in your purview. Can you tell us about some things you think are particularly interesting or inspiring, or have shown a way of responding that you think is a model that others should hear about, that from you could select from any agency around the country of something, either to address these equity issues that we've talked about and making sure that that we're providing that sort of core mobility for those who depend on it, or other ways in responding during this difficult time.
Absolutely. And I think there's a couple of items actually, and I think Phil is a good person to talk to this question, because I think LA Metro's done some of the best work in the country around equity issues. Having someone on staff devoted to talking about that topic, not in a HR kind of way, but in a policy way, is important. And LA Metro has that. Another would be the work we've done on the national level at APTA around doing a racial equity scorecard, which would help the industry kind of get a sense of where we are right now when it comes to racial equity, particularly when it comes to doing anti-racist policy work, to have a good baseline for understanding where we are, which I think actually can have positive outcomes for the advocacy effort. And one reason why I mentioned the civil unrest is the fact that since Americans are confronting our existing institutions, we can start to ask the question, is the 80-20 split correct? The fact that, surface transportation spending has an 80% split to highway and a 20% split to transit. People who care about equity are asking the question, is that the right split? And when you poll the American people, they actually think that transit gets more than it does. So even the expectations of the American people more broadly are not being met when it comes to this funding mix. So this is the right time to ask those sort of questions, because now there's a community of people who are looking for ways to reform our society. And I think transit has had a long list of things that we would like to do that would help our services, position ourselves better to be more equitable, but also operate more efficiently. And now's the time to ask that and frame it in terms of racial equity, because there's community fighting for that. And it's important for transit to show its value proposition when it relates to mobility justice, particularly going forward. And I think, I think the racial equity scorecard, the work that LA Metro's done, the work that we've seen some other agencies do around starting to ask the difficult questions internally, to look at their hiring practices, look at their managerial practices, seeing if the right people are at the table when you talk about stakeholder groups. All of these things are important. And I'm happy to see that that's happening. But I think there's a nice confluence of events right now where transit is facing high political risk, where we could have great outcomes next year if we position ourselves well, or we could still have a system that's not working well. And when I say a system, I mean a democracy that's not working well, if it cannot even get another round of coronavirus relief funding, which is critical to our agencies. So a lot of political risk, but we can manage that risk by in as many different places as possible. And I'm someone who talks a lot about the racial equity area, but there are other areas we could talk about to position ourselves as best as possible so that when people talk about their core issues, transit is one of those core issues they talk about, positioning for the future.
So to pick up on that, and back to you, Phil, this is not only a time where you're attempting to kind of make sure that you're being more inclusive in planning processes. There's a time where actually reaching your riders and talking to them and hearing about what their concerns are, talking to community groups, it has an added challenge because of the pandemic. How are you managing to engage sort of stakeholders and groups that have such a big stake in this transit service to address these kinds of issues like racial justice and core levels of service during a time when it's so difficult to do it through traditional means? Is there a way that you've been coping with that?
Sure. I think, we had been, even pre-COVID, we had been really outreaching to various groups. We've been doing that really since Measure M, when we passed Measure M in 2016. So we have been talking to groups like the clergy, the faith leaders, various community groups all along. And these are quarterly meetings that, for example, I have with the faith leaders all over LA County. This is incredible that, there's a forum there, and then they go back, in the case of faith leaders, and talk to their parishioners, which is thousands of people. And I would say even millions, in talking to all these faith leaders who have parishioners. So the idea of engaging with these groups was not foreign to us. What we did in speaking with those groups when the pandemic hit was explaining to them how we wanted to do it virtually. And we taught a lot of folks, how to use Zooms and life size and all of that. And so we have been very, very aggressive and successful, I think, in talking with the various groups. Now, this is never easy. When you talk about low income and you talk about others that are primarily bus riders, where the average annual income for bus riders in Los Angeles is like $18,000 a year. For rail, it's like $28,000 a year. So it's very, very low. So we have found ways to tap into apps and talk via cell phones, and disseminate information that way. The app that you mentioned on being able to determine how many people are on the bus, we have deployed that app already. So there's always improvement in these areas of engaging, especially low income, but we are finding ways to do that. Now, obviously, we want to improve that. One of the other things I would say is the issue of homelessness. The issue of homelessness. Now, this is one of the reasons why I did not declare during the pandemic our system free. We went to rear door boarding, and essentially we are and were a free system, but I was hesitant to declare it free because of the homelessness challenge on our buses and our trains. And we can get into that, but that has been an issue. When you talk nationally, and your question earlier was, nationally, what's happening? I talked to my friend in New York who's running New York MTA. I mean, we were talking regularly, talking about, how we were going to approach various things and sharing with them and people on the East Coast and the legacy systems, how we were addressing the issue of homelessness on our system, and how we were addressing the issue of fareless system by going on with rear door boarding, at least on buses. And then in really communicating that with and outreaching those things to our riders, especially the low income riders. So we found a way to do that all within the context of equity, as well as Darnell was saying. Everything that we do now, and we started this even before the pandemic hit, we are looking through the lens of equity on how it impacts these various communities and how it benefits or penalizes affected and low income communities. And so again, things we can improve, but I think we've come a long way, and I think we've done a lot in that area.
Okay, I don't want to monopolize things, so I'm going to turn things over to some of the questions. I'd note, in the interest of a shameless plug, that a group of researchers here at the UCLA Institute of Transportation Studies are doing a series of studies looking at homelessness in public transit. And that's being led by Anastasia Lukaitis-Sideris and a number of others, including Jacob Wasserman. Jacob, do you have a first questioner for us?
I think that's supposed to be me. Hi, Brian, Darnell, and Phil. Really great to see you all and appreciate you opening up this conversation. My question is, has there been a push among transit agencies to assess which routes are serving low-income communities and communities of color? And have they been using this kind of analysis to determine kind of COVID service changes? And if that is the case, a follow-up question would be, how do you kind of foresee this type of analysis feeding into future service changes post?
I can start with that, Darnell and Brian. I think it's important that transit agencies develop what I call dynamic service adjustments. Now, a lot of transit agencies will say, hey, we need time to make these service adjustments. We have to have a vote, and we have to have a run board. And, and a lot of these agencies, they take months to do service changes. What I asked my operations folks to do was to monitor on at least a weekly basis, sometimes a daily basis, monitor what our ridership looks like in definitely our heavily used corridors, but all around LA County. Now, LA County is the largest county in America. It's huge. And so monitoring that is a chore, but we developed this dynamic on-street reality kind of service change that allowed us to add resources, add more rolling stock on routes that we saw were getting crowded. And we did that. We did that at the height of the pandemic. We're still doing that right now. So I think that becomes very, very important to do. Now, the idea, though, of social distancing on every bus, now this is, in my opinion, financially unsustainable. And so I have challenged, in this case, USDOT, to say there should only be one standard for social distancing in transportation. For example, you can't have a separate standard for like airlines. Now, we know the airlines want to fill seats. You have some airlines that say leave the middle seat open. That's not 6 feet right there. And so if we need to have one standard around social distancing, and I've said that social distancing where practicable on buses and trains. I mean, thus the term mass transit. And so we are leaning heavily on three big things that I mentioned earlier: face coverings, requiring face coverings, cleaning protocols, strengthened cleaning protocols, and air circulation. And I think that is kind of what we are going to have to rely on, because for me to limit my buses to say 14 people on a bus on a 40-footer, I would have to put 300 more buses out on the street right now. It's financially unsustainable. And so I think all of these things, along with dynamic service adjustments on the street, almost when you see crowding, becomes very, very important for transit agencies.
Can I ask just well, you know what? Let me turn it over. I see we do have someone else lined up to ask a question. So, and I think Juan, you're handling that. The next questioner is, go ahead.
Yes, our next questioner is Professor Marty Wax.
Mm-hmm.
Hi, and thank you. This is a great panel. You mentioned financial problems, Phil, and my question is about your ability in the short term, and Darnell, about other transit operators beside Metro, your ability in the short term to reallocate money across categories. You know, you're losing sales tax revenue, which is enormously important, at the same time that you're losing fare revenue. Do you have the board support to reallocate some capital funds to operations? Do you find that the CARES Act is flexible enough to let you do the things that you've described? You've described a very agile operational capacity to change in response to needs. I'm wondering whether the financial side is nearly as agile as the operational side.
Thank you, Professor. I can always depend on Professor Marty to hit me with a thought-provoking question. I love it.
Thank you.
Yeah. Well, I mean, you know, as you mentioned, local sales tax, we've taken a huge hit. I went to the board in May and I laid out our forecast for loss of revenue, $1.8 billion over 2 fiscal years. And the CARES Act helped. We got about $861 million in CARES Act funding. The total allocation for LA County was $1 billion. And we did the distribution on that. So we funded all the munis and we provided them a share of that funding. And we ended up with 861. And most of that CARES Act funding, as you may know, was geared toward operations. And so that helped us in that area. So nothing for capital. And so what I proposed was a simple kind of method. And that was a 2-bucket approach. The first bucket is, and I'm talking capital and operations. The first bucket was capital projects that would continue, capital projects and operational things that would continue with the money that we had. And so those capital projects were projects that were in construction. I mean, you know, you've got a life of project budget. You can't stop that project, or you're going to be hit with claims from contractors for delay and disruption and all of that. So that one bucket was filled with things that were under construction and operational kinds of things. The second bucket was filled primarily with projects that are in planning, projects that are doing environmental and those kinds of things. And I went to our board and said, these projects must be deferred for 3 to 6 months. They will move, they will continue to move, albeit slower than what we would want. Because what we did not want to do was stop projects entirely. Because if you stop projects entirely and don't get them to a shovel-ready status, then if money or manna falls from heaven, in the way of CARES 2, if you will, or a stimulus that we're all waiting on, I want those projects to be in the door, as we used to call it in the military. So that 2-bucket approach, very, very simple, with the ability and criteria to move projects along in bucket 2, depending upon what extra money we have, we put that criteria together. And a lot of it was based on equity. A lot of it was based on grant funding that was available that might be reaching its expiration date in terms of grants. And that criteria is working for us to move projects through the bucket 2 sequence. So that is how we have done that. And I do believe, if I could plug ourselves, I do believe we've managed this crisis better than any other large agency in this country by that 2-bucket approach, by not laying off or furloughing people, understanding that the economy at large and people are hurting out there. I think we've managed it as best it could be managed.
Thank you.
So we did some polling of agencies around the country, and the question was, what actions might you take if additional emergency funding is not available by the 15th of October, which just passed? 61% said they would cut service. 45% said they would defer or cancel capital projects. About 38% said they would eliminate routes. So that's sort of the national picture. If additional COVID money is not available, a lot of agencies are facing pain that may have long-term consequences. So it brings us back to this question of political risk inherent with the way Washington is currently functioning and getting the basics done properly.
So can I just ask a follow-up? So we've had a picture painted of service that has shifted and is increasingly low-income riders, increasingly people of color who are depending on this for core mobility. And we're now talking about operators facing a financial cliff and slashing service. This seems to kind of put the current political debates over public finance and income equity and racial justice together in a very sharp relief in terms of that. Is that an issue that you're able to effectively push in Washington around efforts for more funding? Obviously, it goes without saying that a huge amount depends on what happens in the election in early November. But is that sort of resonating with the need to get more money to transit operators?
I could say that I've had some conversations with one team in particular, the challenger who's running for president, and there seems to be an understanding of the connections. I was particularly impressed because the term mobility justice actually was used. So I think there's a understanding out there. That's why I say there's a great deal of, there's a great range of risk. The conditions could be particularly better next year, or they could be more of the same.
Okay. Bill, can you talk a little bit about sort of the national efforts on the COVID? I guess you both can speak to that, about the task force and what it's bringing forth that's different from kind of a larger effort just in terms of funding and response. Are there things coming out of that the audience should hear about?
Sure. I was honored to chair that APTA's National Recovery Task Force, and had a great team, 3 great co-chairs, the CEO from Washington Metro, my friend Paul Wiedefeld, a CEO in Columbus, Ohio, Joanna Pinkerton, and the 3rd co-chair was a really brilliant executive vice president of a private sector firm. And what we looked to do was to instill confidence in riders around the country and public, with the public around the country, that transit was safe, that people could come back to transit. It was designed to help public transit agencies really put in place policies and practices that transit users have told us that they want and expect, because one of these big efforts was to poll and to do a number of things to understand what riders really wanted. So we put together what's called our APTA Health and Safety Commitments Program. And the program really defines 4 core responsibilities for every transit agency and for their passengers. So the idea is there are commitments and responsibilities both for the agency and the rider. And so what we said to transit agencies, and by the way, this task force was about 30 people from around the country, broken up into those 3 groups. What we said to transit agencies to join the program, the transit agency was to make 4 major commitments to our riders. The first was follow official health agency guidance. These are the transit agencies. The second was cleaning and disinfecting. The third was providing information and resources to riders. And the third was doing everything possible to keep transit employees healthy. Now, again, this is a commitments program. We're not going out and trying to police everything, but this is saying to transit agencies, will you be committed to these things? In return, we asked riders for 4 commitments, and they were and are, they should also follow the official guidance of health agencies, wear face coverings and wash their hands, maintain social distancing when practical, and don't ride the system if they feel sick. And so this commitments program, we asked transit agencies to join. If they joined, they received a toolkit where they could customize the emblems and all of this seal, if you will, and put it on their buses, their trains, their bus stops. And we have 200 agencies that have already signed on, over 200 agencies, including LA Metro, of course. And so the idea is to send a message to the public that it is safe to come back to transit, and these transit agencies are committed to doing these various things. This has worked. Now, there's a number of other things that this task force worked on, but that was the main deliverable. I mean, we've got best practices on the resource website, all of those things. But I think it was a tremendous success. I think that the task force did tremendous work, and that final report is due in the next 2 or 3 weeks, and we'll be happy to share that.
One observation, just again from our review, we started of the literature on public health and transit. So we started looking internationally. We kept looking for papers and studies of public transit and public health. And what we found was not so many of those. And if I can kind of infer from the literature, is the issue is that in many other countries, public transit wasn't singled out as somehow this particularly risky thing. It was part and parcel of the public health response, and that the expectation was that during the actually SARS-1 and during H1N1 and some of these other epidemics that struck in countries in Asia, for example, that the expectation was there would be universal mask wearing, that there would be but this was not put on the transit agencies in particular. They were simply responding to larger public health guidance as any one of many other public agencies, and and again, I'm just sort of reading in here. There's been this thing about, well, there's something about public transit, or there's these obligations that are different, and again, we kept looking. Often public transit would be included in articles along with, parks and playgrounds and schools and evaluating everything else, but it wasn't singled out in any way. And it does strike me, and it might be a different role that transit plays in the US, but the transit agencies weren't responsible for mask compliance. That was a society-wide.
Right.
It didn't fall on the transit agencies to come up with rules about that. That was just what was expected. And so the contrast is kind of interesting looking at the US from some of these other studies.
I'm still perplexed about why the mask thing is an issue for so many people. And I think that might be I don't want to say uniquely American, but perhaps it is. But masks work, obviously.
Absolutely. Yeah, they do work. And I think, Brian, you're right. I think here in America, there is a hyper focus on transit, more so than anywhere in the world. I mean, the advocacy groups around transit are incredible. I mean, all over this country. It's not any other, public form of service. It's the hyper focus and the hypersensitivity. It's around transit, and I think there's various reasons for it. I think one, transit is very visible all over this country. I think we had 10 billion boardings or something like that a year or so ago. I think that APTA put out. It's heavily used, but the advocacy groups around public transportation, there is no shortage of them anywhere in this country, and it's incredible. And you're right, it's different around, I don't think you have this hyper sensitivity around transit any place else in the world. US has the most.
And I wonder if it's because it's somewhat racialized or has class elements. And I think America has issues on both class and race that needs to be processed and addressed. And I think over time will be. So those public services that are associated with people in a different caste system, I think that's going to be a challenge. But the younger generations, I think, might view it differently than a lot of folks have in the past.
Yeah, and I'll just add this too, Brian. I don't know if you're going there, but I think when we talk about what Darnell just mentioned, the caste system and different things, I mean, this is one of the reasons why I have introduced the idea of a fareless transit system, which you and I have talked about before. And people will disagree with me on this, but I do believe that this is something, I believe, and I've said this, that we have a moral obligation to pursue and study a fareless system and help our region recover from the pandemic and really the effects of the lack of affordability in this region. And we have launched the task force to move in that direction, but it gets to exactly what we've been talking about, and Darnell just mentioned in terms of caste systems and even equity. It gets to all of those things. So just wanted to throw that in as I won't charge you for that.
Okay. and one thing I love about
tree fairs. Sorry.
I was just saying, one thing I love about transit is one of our key ethos is this belief in access to opportunity for people. And I think when society is dealing with a pandemic that has made, visible the cracks in our society, transit needs to once again be viewed as a way to sort of address those inequities and to smooth that over. And we play a critical role that is part of our ethos and our mission.
Okay, let me get another questioner in here. I believe Anson Stewart is up next. Is that right?
That's right.
Anson Stewart. I'm a research scientist at MIT, and I lead analysis at Conceptual. I love this idea of dynamic service adjustments. I think that, traditionally, if we're looking at having to do service cuts in January, that means to get things in place for the January pick, we're doing those service plans now, we're developing the schedules now, and it's like a 3-month lead period, even though if things go in a certain way on November 3rd, we might not need those. So I think the idea of really tightening that time frame is key. But I'd also love to hear your reflections on kind of the longer term and more durable infrastructure. So, how do we pair these dynamic service adjustments with infrastructure that's been in place for decades or a century? So as a very specific example, how could you reimagine the loop in Chicago? There's that's been serving kind of what some might call the choice riders for many years, whereas service in other parts of the network has not served the needs of essential workers as well. I think Transit Center has used the term all-purpose riders, the riders who rely on transit for trips every day, all of their trips. So with this idea of access to opportunities, all-purpose riders serving those essential trips, how could we think about repositioning transit to serve those needs, especially if downtown office demand just is permanently lowered from what it was? Thanks.
Well, I'll start. I think it's a great question. Much of infrastructure, physical infrastructure, is hardwired. You mentioned the loop in Chicago. I happen to be from Chicago, so I understand exactly what you're talking about. I think we have to take a hard look at how we deal with the hardwire infrastructure, physical infrastructure that can't necessarily be moved. I had a chance to talk to Rahm Emanuel, who the former mayor of Chicago, just about the Chicago Transit Authority. The public housing that I grew up in on the far south side of Chicago, there's been talk to extend the rail line there. The talk has been going on for like 50 years. And, I asked him about that. I mean, when is this going to happen? So, he talked about their work in trying to make that happen. But I think this is a very, very tough question, and how to reposition transit. I think we have to be able to adjust service quicker than a 3-month shakeup or something like that. Those are things that we can do relatively quicker or quickly. And we've done that during the pandemic. Transit agencies cut their service by 50% in some cases, 60. And they did that without waiting on a 3-month shakeup. They cut that pretty quick. The key is, how do you replenish that service or increase that service in a very, very short period of time? So there's no easy answer, in terms of how to deal with the longer term. But I think we can look at what's happening now and try to figure out what the new normal is. I do think that there's going to be some degree of telecommuting that exists even after we get a vaccine. But in terms of those low income populations, those people that are made up of essential workers, they will probably need more transit service, more than less. Because they cannot afford to stay home. So I think we have to do a better job of that. And I think transit agencies around the country and their innovation offices are thinking about ways to solve that.
One thing I would add to Phil's comment would be our interactions with the built environment, because sometimes the built environment might be more flexible. So as there are changes in demand for commercial space, how readily can that commercial space be changed into residential, for example? Because there still is a lot of housing demand, and we serve a lot of those core areas where people want to be in the first place. So we can reduce some proper housing policy can reduce some of the pressure that exists around some transit stations when it comes to housing prices and pressure. So that's one example. The other would be the sort of fight for the curb and the ability of, once again, our buses and micro transit vehicles to be able to navigate the streets well and not be interfacing with a lot of traffic. If we can get our own lanes or jump lanes or signal priority, these are sort of things that can be done that can provide additional capacity to transit and speed, which would be useful in a shorter period of time than some of the longer term infrastructure questions that may exist.
So let me pick up on a comment that Phil had closed with, and then go back to you, Darnell, on just the issues you were talking about with with that example of curbs. Deborah Salon, who spoke on Tuesday afternoon about long-term travel implications coming out of the pandemic, and we can shift here at the end a little bit to think about post-pandemic. her question was to Darnell. I really appreciate your comments about using the opportunity to reposition transit to be stronger in a post-pandemic America. I'd love to hear more details about specific ideas you have in mind on what we might do to make this happen. And you just gave one example around curb management, and I'd point out as well, we seem to take it as accepted that we use public right-of-way so people can store their private property on the street in terms of their cars, and that's a really important use. We don't allow other people to do that, and that private property storage often takes precedence over transit lanes, for example. But can you offer Deborah and the audience some other ideas of what you think about a stronger post-pandemic transit that's more just and equitable?
Sure. One thing that's really important, and I mentioned it a little bit earlier, the affordability crisis near transit, because transit is such a great community amenity. As housing is becoming more difficult for people to stay in near transit. So one of the things I think would be useful is for FTA and others to think about how much surplus property can the transit agency capture when they do a project. So we know there's models for this overseas where, transit agencies might have more control over parcels, more parcels after the project's completed. My understanding and reading is that we're relatively constricting in the US when it comes to that. So that'd be one area, because I think, once again, going back to what ethos do transit operators tend to have, we do care about affordability. Phil can talk about this a lot because a lot of great stuff is happening in LA with, was it transit-oriented communities, I believe it is.
Yeah.
So I'll pass it your way, but I think, having the bureaucracy, the federal government, be responsive to these opportunities for innovation that can lead to greater equity would be extraordinarily important. So once again, I go back to the timing of what we can ask for. So funding, regulatory support, also, a lot of the regulatory issues will be local, because of course, getting a housing project completed is extraordinarily difficult in a lot of places. And I hear this is the issue in California, the timeline to get housing completed, and what happens to the cost of housing as a result. So I think thinking about transit, but also those things that are around our operating environment, and if we can have political coalitions that can help us influence those outcomes in our operating environment would be useful. Going back to the homeless question, for example, transit agencies cannot solve the homeless crisis. It's something that is much larger, large societal issue. So engaging with movements that are attempting to address that would be useful, because we can't solve that alone. So once again, trying to directly address our operating environment that we find ourselves in is going to be key.
Yeah, and if I could just add very briefly to that, Brian, because I think Darnell is right on. What I've talked about over a number of years is we are, first of all, we being transit, we are much more than just buses and trains. Now, we know that that's our core business. We get that, but we're much more than that. And so, we are a socio-economic enabler. And so in terms of mobility equals freedom. And so while we do not control everything, we can step into these leadership voids. Stepping into those leadership voids, by doing that, we can instigate, we can influence, we can impact, if you will. Those folks that are and do control the things that we don't control, like affordability, transit-oriented communities, homelessness, all of these things, by us instigating and stepping into these leadership voids, we can influence and encourage those folks that's supposed to be doing this stuff to do it. Mm-hmm. And so I like to think of us as catalysts. If we simply begin to talk about it, when you talk about land use, around transit stations and even expanding that radius. Right now, the TOD, people, talk about transit-oriented development. I've begun to call this transit-oriented communities and expand the radius around the transit asset to talk about, hey, 2 miles around our station, we want to see X, Y, and Z. We want to see a new supermarket in an otherwise food desert. And just by bringing that up, just by saying that, and just by perhaps getting our boards to take a position on those kind of things, will encourage the Krogers of the world to think about a supermarket in that area. I mean, we just did that with the groundbreaking for our transportation school just this past Wednesday. And so people will say, what are you doing getting into the school business? Well, guess what? It's the ultimate succession plan. Getting young people, and especially young people of color, and foster care kids and kids whose parents that have been in the justice system will be in this boarding school concept, grades 9 to 12, in the heart of South Los Angeles. And so we're not educators, but guess what? We started the conversation and we just broke ground on the school. So there's things that we can do to instigate and to push people that are supposed to be doing what, in terms of societal kinds of things, we can push them to do that.
And the way Phil is describing this means that, a lot of people might view transit service as a gentrifier, but we are actually equalizer if we're following what Phil is talking about. And the more people that understand that transit plays that role, the more success we'll have in incorporating ourselves into these movements that might get us more political power. So I think, the way Phil's describing it is critical.
We have our last audience question, and then I'll give you a chance to each. I have a wrap-up query for each of you. So Nancy, can you turn your camera on?
There we go. Hi, thank you so much for the opportunity to ask this live, and thanks for all your great comments. In a way, you're starting to answer my question already, but I want to ask you all to stand back and think about what are the changes that have happened during the COVID era that are positive. How have they been positive? And for those changes, which ones ought to continue once we're post-pandemic, and what kinds of policies or practice changes are needed to encourage all of that to happen? I want to ask this question of every panel, the whole conference. I want to know, and I'm happy to hear your responses. Thank you.
Well, I'll start. I think, and we've been thinking long and hard about this. I asked my Office of Extraordinary Innovation to think about just that question that you just posed. When I looked out my window during the height of the pandemic, the air was cleaner than it's ever been in Southern California. I mean, I could see all the way to, definitely to Long Beach. And my assistant was like, no, Phil, that's past Long Beach. I was like, that's incredible. And so I think that if we are serious about climate change and serious about reducing our carbon footprint, then we need to attack both the congestion and gridlock in this region. I mean, I was looking out at the 101 and cars was going 75 miles an hour. I mean, I couldn't believe it. I was like, oh my God. I mean, it's like no gridlock. It's no congestion in Los Angeles. Nuts. That is and we can do this through our traffic reduction programs and, dare I say, congestion pricing. And we have been on this even before the pandemic. So we need, to answer your question, in my view, we need some type of traffic reduction program along with a fareless transit system. And we've been talking about this for a couple of years now. That will then result, I believe, in better air quality, like we saw at the height of the pandemic, and better breathing and all of that. So I'll just end with, the rhetorical question is, how do we want to live? How do we want to live? Do we want to live with gridlock, bad air, congestion, or do we want something better?
And I would say there's been a change in ethos that I've noticed a little bit, which would be people increasingly are asking for forgiveness, not permission, because the conditions that we face on a daily basis requires us to act. And I think that change in perspective is something that we should keep.
Mm-hmm.
So thank you. We're just running out of time. So if you could each give us a short answer on this, and this picks up a little bit from where Nancy was, is that tell me where you'd like to see, in the case of Darnell, the transit industry in the US a year from now. Where should it be relative to where it is today and where it was a year ago? And Phil, more specifically here in Southern California, where would you like to see LA Metro a year from now? Where could and should it be relative to where it is now? And I think of this as somewhat aspirational, not sort of practical. Mm-hmm. And if you could just give me a 30-second riff on that, that's a way I'd like to close this terrific session.
Cool. I'll go first. I think if we are viewed as a tool in addressing our questions around race and socioeconomic opportunity, and people view us as a tool to address those issues politically. So if you're someone who cares primarily about some other topic not associated with transit whatsoever, you would be, public transportation is critical to me actually reaching the objectives of what we have, even though I'm not involved with the transit industry at all. So I want us to be viewed as someone that can be pulled off the shelf to be a problem solver for the whole number of issues that people are addressing right now when it comes to access to opportunity, racial justice, all these concepts. That's one reason why I got involved in transit, is because I viewed it as one of those tools, which also, by the way, historically, transportation used to be a lot more bipartisan. So it's one of those, mom and apple pie type interventions that could actually improve society. And the more people who believe that and want to fund it appropriately and want to get us closer to a better split between highway and transit funding, I think that would be a great place to be in a year.
Yeah, and I would say here in Southern California, I want to see public transportation be even more essential for getting LA County residents back to work. I want to see us to enhance communities and lives through mobility even more than we've done before. I want us to continue in even more shape land use and development patterns, especially when it comes to affordability. I want us to, on the capital side, to generate jobs and economic growth. The fact that the governor and the mayor allowed construction to continue as an essential service, very, very important for jobs and people on our construction sites. I think this downturn would have been worse if construction was not deemed essential. And then the last thing is to just have an even greater impact on society. Transit, and that comes with education of so many people as to what infrastructure does and how they benefit in their daily lives, how infrastructure plays a role in that. We have to humanize infrastructure, humanize it so people understand exactly what we're talking about and understand the benefit that we bring to millions of people in this country and here in LA County.
Thank you so much to both of you for taking the time to speak to us today. This is, as I'd mentioned, would normally be the time where we'd have a roar of applause. for your comments, insightful and humanizing what can be seen as a technical issue because of the urgency of the service provided and the dependence of people who have been marginalized in so many ways to be able to have mobility. This is a powerful discussion. I want to thank you both. I want to thank the Transit Center for sponsoring this session. Our next session is next Wednesday, October 28th at 9:30 a.m. Pacific time. And it features a discussion on outreach to co-powerment, achieving transportation justice through reparative planning and engagement. But first, we're going to have a social breakout sponsored by WSP for those participating. Check the chat for the breakout room link. And once you join the Zoom main meeting room, you'll be able to self-select into a breakout room. We're trying to replicate the ability to chat after an event rather than just listening to it passively on the screen. There's no obligation. Our speakers are welcome to join those breakouts as well if they have time. And I hope to see you all in there. You may need to close the webinar window in order to participate in the breakout. Thank you again so much. And